Junior doctors in Malaysia are planning for a strike. What? I'm Dr. Han, and let me break down the story for you after the intro. After some clarification, this is not a full-on strike, but actually a protest organized by the junior contract doctors. In order for us to understand this situation, first we have to go back in history to find out the cause of why there is such a problem of contract doctors. In the 1960s, after our country's independence to the 1980s, there were only 3 public medical schools, which are UKM and USM. Then, within the year 1995 to year 2000, within these 5 years' time, the number shot up to 6 public universities and 4 private medical universities, totaling the number into 10 medical schools. And then, in the early 2000s, in the year 2002 to 2012, within this short period of 10 years, the numbers shot up from 10 medical schools to 33 medical schools in total. So you can imagine and expect that the numbers of graduates shot up significantly within such a short period of time, but the number of government hospital bed and government clinic did not go up accordingly. So now we have a problem of having the number of government doctors, government medical officers in excess. When the government was facing this issue, instead of solving the problem from the root cause, it gave a band-aid solution, which was when the fresh graduates were coming into the government service, they classified them as contract officers. Before 2016, the new medical graduates joined the government compulsory service as permanent officers, where they enjoy all the benefits of becoming a government servant. But after 2016, the situation changed. The newcomers are now classified as contract healthcare workers, where all the benefits just vanished. The same situation is also happening to the dental and the pharmacy new graduates as well. From 2016 until now, there has been about 23,000 of graduates joining the government medical service, but only about 700 of them has been absorbed into the government healthcare system as permanent officers, while others are still stuck in the limbo of becoming or being a contract healthcare worker. Well, you may ask, contract doctors, permanent doctors, what are the problems? They are still having a job, and how can this situation affect me? Now, let me tell you a few problems that may happen if this issue persists for a long period of time. Number 1, specialist training program is not accessible to those contract doctors. When those contract doctors, they cannot study and become specialists, so throughout time, in long run, the senior specialists may slowly retire, and there may not be enough new specialists to come and join and replace them. Number 2, no transparent criteria with regards to the selection of permanent posts. Nobody knows exactly how the permanent officers are selected, and nobody actually knows how exactly were those 700 permanent doctors had been selected from the 23,000 contract officers. Tak tahu. Number 3, no proper plan for career progression and salary adjustment. If you are a permanent officer, you would know exactly every few years you will get your grade increased and your salary adjustment. But things are blurry for the contract doctors, so they may be doing the same type of work, the same amount of work as their permanent doctors' peers, but at the same time they may get paid much less compared to their permanent doctors' peers. Number 4, with such an unclear career pathway, young talented doctors may be leaving Malaysia to other places, to other countries to find a better job security, better working environment, and even better salary. If that's the case, then we will be losing a lot of young, talented doctors in the country. What can you do to contribute in order to improve this situation? Yes, you can help by raising the awareness regarding this issue. On the 1st of July to the 12th of July, you can change the profile picture on your social media to black or monochrome, black and white. And on the 12th of July, you may post picture with hashtags of hashtag Save My Contract HCW, hashtag Code Black MY, and also hashtag Black Monday MY. This is Code Black. Code Black refers to a hospital emergency denoting a threat to the hospital personnel or even a bomb threat to the hospital. This contract healthcare worker situation is a ticking time bomb, and if it explodes, it will affect the lives of all Malaysians. Not only the livelihood of the contract healthcare worker will be affected, your healthcare service that has sustained Malaysia for the past 6 decades since Merdeka will also be affected. This is why it is called Code Black. And we need to remove this threat before it reaches to the point of no return. That's all I want to share with you today. I'm Gigi Han. Like this video if you like it, sub if you love it, and this is another video of me telling you why you should not become a dentist, and I will see you in the next video. Gigi Han out.